Imagine swallowing a tiny, precisely engineered pill, and its only job is to, hunt down and kill a microscopic parasite that's hiding inside your tissues.
Right. Sounds like a total success story.
Exactly. You'd probably think the danger is over the second that invader is dead. But here is the terrifying reality of the medical pharmacology we are diving into today.
It's a dark reality.
It really is, because when it comes to parasitic infections, the dead worm is often vastly more dangerous to you than the living one.
Yeah, which goes against basically everything we assume about medicine.
Right. So today, we are opening up a stack of medical pharmacology texts detailing anthelmintic drugs.
That's the clinical term for drugs that treat parasitic worms,
Ah,
helminths.
yes, exactly. And our mission for this deep dive is to decode the really brilliant biological exploits these drugs use to assassinate parasites without harming you, the human host.
But we also have to explore the intense biological fallout of that assassination.
Because the clinical management of these infections is just a bizarre paradox. We are so conditioned to view medicine as a simple process. You take an antibiotic, the bacteria die, you feel better.
I mean, that's the standard model. But helminths are totally different. They're complex, multicellular animals. They have nervous systems and muscles and digestive tracts.
Right.
So when you abruptly destroy a complex organism inside the human body, you aren't just neutralizing a threat. You are creating a microscopic biological disaster area.
A disaster area that your own immune system now has to clean up.
Exactly.
So before we get into the chemical weapons themselves, we really have to map out the adversaries here. The pharmacology texts group the worms that infect humans into three main classes.
Right, the big three.
Yeah. First, we have the nematodes. These are your classic elongated roundworms. And they are fully self-sufficient. I mean, they have a complete digestive system from mouth to anus.
They're what most people picture when they hear the word worm.
Yeah, exactly. Then you have the trematodes, which are also known as flukes. These are flatworms. They're generally leaf-shaped, and they are categorized by the specific tissues they like to invade. So you'll hear about liver flukes or lung flukes.
They're highly specialized.
Very. And finally, there are the cestodes. These are the tapeworms.
The weirdest of the bunch.
Completely. They are flat, highly segmented, and they're just strange because they totally lack a mouth or a digestive tract for their entire life cycle.
Right, because tapeworms bypass the need for a digestive system entirely. They basically just anchor themselves directly into the host's intestinal tract.
Just latch right on.
Yeah, they're constantly bathed in food that the human host has already done all the hard work of digesting. So they simply absorb those pre-digested nutrients right through their skin.
Wow.
Yeah, the tegument, it's called. They basically outsource their entire metabolism to you.
Which is incredibly efficient, but deeply unsettling.
Oh, absolutely.
But, as I was reading through the mechanisms of the drugs used to fight them, I realized you can conceptualize these medications like finding a software bug in an alien operating system.
Oh, that's a great way to look at it.
Right, because the drugs are engineered to target metabolic pathways or like specific cellular receptors that exist in the parasite's code, but are either totally absent in human biology or at least distinctly different.
Yeah.
So you're basically running a targeted exploit that crashes the worm's operating system while leaving the humans untouched.
And that's the holy grail of pharmacology. If a drug targets a biological structure that humans simply do not possess, the inherent toxicity to the human is remarkably low.
You found the perfect vulnerability.
Right. But the challenge is dealing with the wreckage once that alien software crashes.
Okay, so I'll see that exploit in action against the most common worms, the nematodes. The sources point to two primary methods of attack for these roundworms: starvation and paralysis.
The two big strategies.
Yeah. So I want to start with the starvation strategy, utilizing a synthetic compound called mebendazole. It's a broad-spectrum drug used against whipworms, roundworms, and hookworms. But, how does a pill actually starve a worm that is literally swimming in your food?
Well, mebendazole targets a cellular structure called a microtubule. You can think of microtubules as the internal scaffolding, like the microscopic conveyor belts inside a cell.
Okay, conveyor belts.
Right. And in the parasite, these conveyor belts are absolutely essential for transporting nutrients, specifically glucose. They move it from the outside environment into their cells.
Oh, I see.
Yeah. So mebendazole is designed to selectively bind to the parasite's microtubules and block them from assembling. So the conveyor belt just breaks down.
Wow. So they can't eat.
Exactly.
Okay.
Because of this, the worm's ability to take up glucose drops to near zero. It exhausts its energy reserves, it loses its physical grip on the intestinal wall, and then the paralyzed, starving parasite is just,
Simply expelled from the body.
right, it just passes right out.
The text gives this highly specific, very visceral, real-world case study of this. So a 5-year-old girl is picked up early from preschool complaining of abdominal pain and severe perianal itching.
A classic presentation.
Yeah, and her pediatrician uses something called a cellophane tape swab. I mean, they are literally pressing clear tape to the skin around the area to collect and identify these translucent eggs.
Right, the tape test.
And they diagnose her with Enterobius formicularis, the pinworm, which shockingly is actually the most common helminthic infection in the United States, and mebendazole is the frontline treatment.
Yeah, the tape test is such a classic diagnostic because female pinworms have this distinct behavioral pattern. They actually migrate out of the host's intestinal tract at night to lay their eggs on the surrounding skin.
Ugh, which is what causes the intense itching.
Exactly. Now, the pharmacology of mebendazole has a really brilliant little quirk here. The drug is nearly completely insoluble in water.
Meaning it doesn't dissolve well.
Right. So if that 5-year-old takes the pill on an empty stomach, very little of it is absorbed into her bloodstream. It mostly just washes through the gut, hitting the worms directly where they live.
Oh, that's super convenient.
But if a patient needs the drug to reach parasites that have migrated into tissues outside the gut, they are instructed to take mebendazole with a heavy, high-fat meal.
A high-fat meal?
Yeah, because the dietary fat acts as a solvent. It significantly spikes the drug's absorption into the human bloodstream.
That is wild. So you basically use a cheeseburger as a chemical Trojan horse to smuggle the drug into the blood?
Pretty much, yeah.
Okay, so that covers the starvation strategy. The other approach to nematodes in the gut is paralysis, primarily using a drug called pyrantel pamoate.
Right.
The text describes it as a depolarizing neuromuscular blocking agent, which sounds like a lot of medical jargon for it shorts out the nervous system. But what is actually happening at the cellular level there?
Well, it's less about shorting the system out and more about jamming the accelerator to the floor until the engine seizes.
Oh, wow. Okay.
Pyrantel pamoate targets nicotinic receptors on the parasite's muscle cells. In biology, when a nerve wants a muscle to contract, it releases a chemical that binds to these receptors. And that triggers a depolarization, basically an electrical shift, that makes the muscle tense up.
Right, a contraction.
Yeah, and normally that chemical is immediately broken down so the muscle can relax again. But pyrantel pamoate binds to those same receptors, and it doesn't get broken down, it persistently activates them.
It just holds them open.
Yes. The worm's muscles are flooded with a continuous, unbreakable signal to contract.
So it induces a state of rigid, spastic paralysis. The worm is just locked up tight.
Precisely. And because it is rigidly paralyzed, it can no longer fight the natural peristalsis of the human digestive tract.
The wave-like muscular contractions of your intestines.
Right. The worm essentially just becomes inert matter and is flushed out of the system.
Okay, let's unpack this. So we literally either starve them so they lose their grip or paralyze them so they get flushed out. It sounds straightforward, but there must be a catch when it comes to side effects.
There absolutely is a catch.
Wait, because if paralyzing a worm in the gut relies entirely on the human digestive tract to act as a conveyor belt to flush it out, what happens when the worm isn't in the gut? What happens if the parasite is in the bloodstream or the tissues where there is no exit? You can't just flush it away.
And this is where the clinical picture becomes highly volatile. Because if the parasite is trapped inside the body's tissues, you're relying entirely on the human immune system to handle the corpse.
Yikes.
Yeah. Let's look at ivermectin. In the context of helminths, ivermectin is the drug of choice for onchocerciasis, which is commonly known as river blindness.
Okay.
This is caused by a nematode called Onchocerca volvulus that lives in the subcutaneous tissues, so just under the skin. Ivermectin targets glutamate-gated chloride channels in the parasite.
So we are dealing with a completely different cellular exploit here. How do chloride channels work?
Normally, a nerve cell requires a specific electrical baseline to fire a signal. When ivermectin binds to these channels, it forces them open and negatively charged chloride ions flood into the parasite cells.
Okay, so it drops the charge.
Right. This massive influx of negative charge plunges the electrical potential so low a state called hyperpolarization that the nerve simply cannot fire.
Oh, I see.
So unlike the rigid spastic paralysis we just talked about, this causes flaccid paralysis. The worm just goes completely limp.
But human beings have incredibly complex nervous systems too. We rely on electrical gradients and ion channels for every thought and movement. Why doesn't this hyperpolarization happen to us when we take the pill?
What's fascinating here is that ivermectin's safety profile is a masterclass in relying on human anatomical barriers.
Oh, so.
Well, ivermectin is given orally, but it physically cannot cross a healthy human blood-brain barrier.
Oh, wow.
Yeah, that barrier is a highly selective filtration network of tightly packed cells that protects your central nervous system. And because the drug can't breach that wall, it has no pharmacologic effect on the human brain or spinal cord.
That's so elegant.
It is. It circulates in the periphery of the body, freely paralyzing the worms, while your brain remains completely isolated and safe.
But there is a massive caveat in the text regarding that barrier, because ivermectin is strictly contraindicated, meaning you absolutely cannot give it to patients who have meningitis.
Right, and that's crucial. Meningitis is an inflammation of the protective membranes covering the brain and spinal cord. And that inflammation fundamentally alters the architecture of the blood-brain barrier.
It damages the wall.
Exactly. The tight junctions between cells become leaky. The barrier becomes permeable. So if you administer ivermectin to a patient with meningitis, the drug slips right through that compromised wall, enters the central nervous system, and begins affecting human receptors.
Which causes severe neurological toxicity.
Yes.
Very severe.
So the drug is perfectly safe as long as the biological vault door in your head is locked tight. But if an infection props that door open, the cure becomes a poison.
That's exactly right.
But even when the door is locked and the drug safely paralyzes the worm in the tissue, the danger isn't over. Because the sources emphasize something called a Mazzotti-like reaction. Right. So when ivermectin does its job, it kills the microfilaria,
Yeah.
which are the early microscopic life stages of these worms.
Okay.
But as millions of these tiny organisms die simultaneously in the skin and tissues, they break down and they release foreign proteins.
And the immune system notices.
Oh, it notices. The human immune system detects this massive protein spill and mounts an overwhelming inflammatory response. The patient suddenly experiences high fevers, intense headaches, dizziness, and life-threatening drops in blood pressure or hypotension.
It's like detonating a microscopic Trojan horse.
Mm-hmm.
The drug doesn't just quietly assassinate the worm, it basically rings the dinner bell for the host's immune system, and the resulting battlefield debris is what actually makes the patient feel sick.
That's a perfect analogy. The drug didn't cause the fever. The human immune system caused the fever in his panic over the debris.
It's just terrifying.
And we see an even more extreme version of this dynamic with another drug called dithylcarbamazine, or DEC. It's utilized for filariasis, which is an infection caused by worms like Buchereria bancrofti.
These are the parasites that invade the human lymphatic system, right? Blocking the flow of lymph fluid, which leads to elephantiasis, that dramatic, disfiguring swelling of the limbs.
Yes, exactly. And dithylcarbamazine is fascinating because it is essentially a pharmacological bounty hunter.
A bounty hunter.
Yeah. The drug itself doesn't actually kill the microfilaria. Instead, it alters their surface structures and immobilizes them. It basically strips away their stealth mechanisms.
Oh, wow.
It paints a target on them, rendering them vulnerable so the host's own immune cells can track them down and execute them.
That is brilliant. You are weaponizing the host's own white blood cells to do the wet work.
It is brilliant, but it comes with a steep cost. Because you are intentionally triggering the immune system to attack, the adverse effects, the fevers, rashes, and severe joint pains, are intense.
Right, because of all the collateral damage.
Exactly.
Yep.
And the severity of that sickness is directly proportional to the parasite load. The more worms you expose to the immune system at once, the more violent the host's reaction.
So if you have a massive infection,
It becomes a deeply complex clinical scenario. Physicians routinely have to administer powerful antihistamines or corticosteroids alongside the antiparasitic drug just to suppress the patient's immune system enough to survive the cure.
wow, just to survive the cure. So if the immune fallout from dead microscopic worms in the bloodstream is a nightmare, what happens when a tapeworm takes up residence inside the most delicate organs we have, like the brain or the eyes?
That brings us back to the trematodes and the cystodes, the flukes and the tapeworms. The primary weapon against many of these is a drug called praziquantel.
Praziquantel, okay.
It is the agent of choice for schistosomes, which are blood flukes that humans can contract simply by wading in contaminated water, allowing the larvae to penetrate directly through intact skin.
Ugh, that makes my skin crawl.
Right. It's also used for Perigonomus westermani, a lung fluke typically contracted by eating raw or undercooked crab.
So what is the exploit praziquantel uses against these flukes?
Well, praziquantel radically increases the permeability of the parasite cell membranes to calcium.
Okay, calcium.
Yeah, and in biological terms, calcium is the molecular trigger for muscle contraction. It's the signal that tells muscle fibers to physically pull together.
Right, so by messing with that.
By forcing the parasite's cellular doors open, a massive influx of calcium rushes in unchecked. The worm's muscles violently contract, paralyzing it and causing it to dislodge from the host tissue.
It's an incredibly versatile drug. The text actually highlights a case study of a 56-year-old man from South America. He presents to the clinic, and testing reveals he is heavily parasitized by both schistosomes, the blood flukes, and Tassenia solium, the pork tapeworm.
A dual infection.
Yeah, he is harboring two entirely different classes of helminths, but praziquantel is the primary drug effective against both simultaneously.
Right, and it's highly effective for intestinal tapeworms. But Tassenia solium, the pork tapeworm, presents a unique and terrifying medical scenario when humans ingest the eggs rather than the adult cyst.
Wait, what's the difference?
Well, if you ingest the eggs, they hatch into larvae, and those larvae do not stay in the gut. They migrate through the bloodstream and take up residence in human tissue, forming small, calcified cysts.
Oh, no!
Yeah, and when they form those cysts inside the human brain, it causes a condition called neurocysticercosis.
The text details a 48-year-old immigrant from Mexico who arrives at the emergency room suffering from sudden seizures. They test a stool specimen and find the tapeworm eggs, but it's the MRI of his brain that is truly alarming.
Right.
It reveals multiple cysts, like little calcified fortresses built by the tapeworm larva right inside his brain tissue. The drug of choice for this is albendazole, correct?
Yes. Albendazole is chosen because it is highly effective at crossing the blood-brain barrier and penetrating the central nervous system to attack those cysts.
Okay.
But if we connect this to the bigger picture, think back to the dirty bomb metaphor we discussed with the Mazzotti-like reaction.
Oh, God.
Imagine detonating that dirty bomb inside the most fragile and closed space in the human body, the skull.
Here's where it gets really interesting. You're basically cracking open those fortresses, right? Exposing the dying worms directly to the brain's immune cells. You're detonating a bomb inside a highly fragile room. You have to kill the invader, but the shrapnel of the dying worm is so toxic, you might destroy the brain in the process.
Exactly. The destruction of the parasites inside the central nervous system triggers a massive, localized inflammatory response. The brain tissue swells.
Which you do not want.
Absolutely not. The patient can experience agonizing headaches, uncontrolled vomiting, hyperthermia, violent convulsions, and severe mental status changes.
It's just a cascade of terrible effects.
It really is.
Yeah.
Managing neurocysticercosis requires extreme caution. Often, doctors have to use high doses of steroids to preemptively fight the brain's own immune response to the dying cysts.
And as dangerous as that tightrope walk is, the text outlines one specific scenario where the bomb is simply too dangerous to detonate at all.
Yes, praziquantel and albendazole are both absolutely strictly contraindicated for the treatment of ocular cysticercosis.
And that is the condition where the tapeworm larvae have migrated and formed their cysts inside the human eye.
Exactly.
Because if you trigger an immune firestorm inside the eyeball,
The violent immune response to the dying organism will irreversibly destroy the delicate structures of the retina and the optic nerve. The host's immune system will literally blind the patient in its attempt to clear the dead parasite.
oh wow, so you can't use the drugs at all.
Right. In those cases, pharmacological treatment is abandoned entirely. You have to rely on surgical removal because the chemical cure is infinitely worse than the disease.
The deeper we get into this, the more the entire concept of pharmacology shifts, you know? We started by looking at the brilliant exploits of these anthelmintic drugs, like mebendazole starving pinworms by dismantling their microscopic conveyor belts, or parental pomote locking up the muscles of hookworms so they get swept away by the gut. But the ultimate takeaway isn't about the drugs at all.
No, it's not. The recurring theme across all these treatments is that administering medicine against complex organisms is only half the battle. The true medical challenge is managing the host's explosive, sometimes lethal biological response to the dead pathogen.
It really requires a profound respect for the volatility of the human body, and it explains why the safety profiles of these drugs are so rigidly controlled. The pharmacology texts make it a point to emphasize that almost all of these major players, mebendazole, ivermectin, thiabendazole, and albendazole, are strictly contraindicated in pregnancy.
Yes, this raises an important question about how carefully doctors must weigh the cure against the body's reaction to it, because these drugs have been shown in animal models to be teratogenic or embryotoxic.
Meaning they harm the developing fetus.
Precisely. The same mechanisms that disrupt the cellular division and microtubule assembly in a parasite can catastrophically disrupt the rapid cellular development of a human fetus.
Right.
So the stakes of utilizing these targeted exploits are always incredibly high.
It really is a high-wire act of chemical warfare. You are utilizing toxic compounds, relying on anatomical vault doors like the blood-brain barrier to keep you safe, and intentionally triggering your own immune system to act as a bounty hunter.
It's a delicate balance.
It is. And that leaves me with one final, deeply unsettling thought for you to ponder. We have spent this entire deep dive looking at how violently and aggressively the human immune system reacts to dead parasitic worms.
Right, the swelling, the fever.
Exactly, whether it's dropping your blood pressure to life-threatening levels or causing violent convulsions in the brain. If our immune system is that heavily armed and that hyperreactive to the mere debris of a worm, what does that tell us about the terrifyingly brilliant, stealthy ways these parasites manage to hide from our immune system while they're alive?
That is the real mystery. To live for years inside a host that is fully capable of destroying you and to remain completely undetected is the true biological marvel here.
It's alien software running silently in the background, evading every firewall you have.
Perfectly said.
Keep questioning the bizarre inner workings of biology. Stay curious, and we'll catch you on the next deep dive.